Joining us today, professional, public health professional, or a healthcare professional with a BSc degree in biology from McMaster University, Hamilton. She holds a Master's of Science in Nursing from McGill University, Montreal, and recently completed a PhD at the University of Toronto, Ontario Institute for Studies in Education, Applied Psychology, and Human Development. After graduating from nursing, our guest for today worked as a registered nurse at the former Brampton Memorial Hospital and Mount Sinai Hospital in Toronto. She began her career at Toronto Public Health in August 2001 as a public health nurse. She has held positions as a public health nurse coordinator, supervisor, manager, associate director, and director of community health and well-being, and the chief nursing officer at Toronto Public Health. In 2024, our guest for today joined Toronto Children's Services as a district director, and in 2025 joined the City of Toronto Senior Services and Long-Term Care as the general manager. Coaching and mentorship to staff, students, and rising leaders, and has participated in the Registered Nurses Association of Ontario Nursing Leadership Program, McGill University. Thank you for joining us today, Dr. Nicole Welch.
Thank you so much for having me today. I look forward to our conversation.
Okay, so can you please tell us a little about your journey as a health professional or an expert?
Thank you for that question. Uh, so I went into university and completed a Bachelor of Science degree in biology. Wasn't quite sure what the next steps would be. Did take some courses in providing Lamaze training and supporting women and their families as they were giving birth and in hospital. Was quite interested in women's health. So I went to McGill University and completed a Master's of Science in Nursing, where I did focus in on women's health. After McGill University, I did return to Toronto and started working in the hospital. I worked in postpartum units, high risk prenatal. That was at Brampton Hospital and Mount Sinai Hospital. Really enjoyed that work. And then I found out more about public health and how it was delivered here in Ontario. Had the opportunity, applied, and was successful in joining Toronto Public Health as a public health nurse working with young families, or families with young children. So, with the Healthy Baby, Healthy Children program, prenatal, a lot of very interesting work in health promotion and ensuring the health of the population, and really focused in the healthy families area. I then stayed with Toronto Public Health for many years. It was about 22 years. I worked as the director of healthy communities, where I oversaw a large portfolio of work from children, our school health program, our sexual health promotion, working with, we had a team of vulnerable adults and seniors team, our access and equity team, where we did a lot of work with diverse communities, as well as supporting education among our staff. I had the pleasure and honor of working on the Toronto Indigenous Health strategy and working with the community on the health advisory circle. And I also had the opportunity to participate the development of the Confronting Anti-Black Racism Action Plan at the City of Toronto, and that was very, very exciting work. And TPH was able to support and contribute to those very, very important plans to really tackle some of the inequities in our communities. Of course, throughout the pandemic, wow, I had an opportunity to do a little bit of everything within public health. My main role was supporting the schools and childcare and day camps, vaccine clinics for youth and students. And a variety of other things throughout the pandemic. And it was very difficult times, significant impacts on the health of our population. And we still see the impact of the pandemic as we continue to recover. And I had the opportunity after about 9 years as a director at Toronto Public Health to go to Toronto Children's Services, which provides the early learning service navigation and system management here in Toronto for early learning. And it was a great opportunity, learned a lot about a different sector, uh, and continue to support that early development. Uh, and then I had the honor of being successful in the competition to be the general manager for senior services and long term care. We do have 10 homes that we run here in Toronto, and we provide other supports around the Toronto senior strategy, etc. But just such an opportunity. And the one thing I'll say about my career in health is many different opportunities. Like I've always felt challenged, had the opportunity to work with amazing people, love working with community, and really trying to improve the health of the whole population. So I think that's a bit about my journey. Other things were mixed in there. I do enjoy, as my bio was saying, mentoring and supporting students and supporting staff and people who are looking for opportunities to learn more and provide that coaching and some of the leadership tips. I also believe in volunteering and giving back to community as well. So I've had the pleasure over the last 5, 6 years to be on the Durham Community Health Center board of directors. And that was important. I've always wanted to volunteer and get back more into volunteering, um, which was a little bit more challenging when the kids were younger and going to school and everything. But as soon as I was in a different stage where I had more available time, I was thrilled to give back and volunteer.
Okay.
I did a lot of volunteer work with as a a high school student and university student. So really encourage people to do those opportunities as well.
Okay.
Thank you,
Thank you,
Victoria.
Dr. Nicole. I
Hmm.
mean, the trajectory of your career is so inspirational, from public health to indigenous health, indigenous community health, and even in leadership role. And I think you have a lot to offer us in our health week, both in terms of tips on how to keep well and how to continue as even healthcare professionals, learning from you and also learning from others. So you talked about inequities and equities, and you also talked about public health. And sometimes individuals may know their role in keeping themselves well. At some other time, there could be a blur line between what individuals and healthcare providers are supposed to do. So, what do you think the role of individual choices play in their health? And what challenges do they face in making decisions about their health?
Yes. So great question. And individuals play a very important role in their health and, um, you know, um, how best they support themselves, and make decisions as best as possible that keep them healthy. And however, we have to be really aware of the limitations that our systems and communities create and the difficulties that individuals may face if they are living in poverty, if they're not having access to education or jobs or housing. Our system, and we have a responsibility as healthcare workers, as government, as citizens and fellow human beings to really help everybody achieve a better health outcomes. And health includes everything. So it's not just about your physical health, it's about your mental health as well. And we really look at social determinants of health and how that impacts individuals' ability to make choice because the systems are set up such that some people's choices are very limited. So, although they may want to have access to healthy food, they may not have the funds to buy those healthy foods. And sometimes even if they have a small amount of funds, it may not be accessible because they're not living in a neighborhood where there are grocery stores with a lot of fresh fruit, etc. So those pose significant challenges if they have any mobility challenges or unable to travel further from their home to access healthy foods. So it's really twofold. Like individuals have the responsibility of their health and know, oftentimes they know what's best for them and their families and want to achieve, but society as a whole and the way we support people in communities, we need to change the overall system so that we are tackling the social determinants of health and we really work on decreasing those inequities that we see in our communities. Thank you.
Okay. Thank you, Dr. Nicole. And that leads us to the next question. When you're talking about systems and how we can improve how can we improve the entire way, access to food security, access to healthcare, our overall better systems integration to ensure these health outcomes are better.
Mm.
And I was just wondering, how can healthcare providers specifically influence and improve individuals' healthy decision?
Mhm. So I think it's very important as healthcare providers that we really respect the individuals. And as mentioned, went to school at McGill where I did my Master's of Science in Nursing. And McGill has a nursing model, and it's something that I have really relied on throughout my career. And because it's more complicated than I'll describe at this moment, but essentially the basis of it is that when you're working with an individual or communities, that they have a level of expertise about themselves, what they need, having an understanding of who they are. And as a healthcare professional, we work collaboratively with the individual to provide the more scientific, data driven information that we have as healthcare professionals to help support them. But it's a very respectful relationship. And as healthcare professionals, we can offer the advice, and individuals can take it and they have to make decisions. But as healthcare professionals, we have to be aware of the barriers that are placed on individuals. So we may offer advice to um, access healthy foods and give a list of all these healthy foods. But in the absence of asking the individual about their ability to purchase those foods, their ability to find those foods, and not really understanding their whole story, we can limit how best to support them. So we really need to be working with the individuals to understand their life story, understand, if they're living in poverty, if they have certain vulnerabilities, if they're experiencing any violence in their life, etc., that can really, prevent them from having the ability to access those resources that will make them as healthy as possible. So I really go back to that McGill model of nursing about respecting the individual, and their knowledge and their understanding of who they are, where they fit with their family, as a healthcare professional, providing that support to the individual and who they define as their family as well.
All right. The McGill model.
Yes, McGill
Yeah,
model of nursing.
yeah. Respecting the individual's choices, understanding their stories, understanding their community, understanding their needs, or even their socioeconomic status. And
Hmm.
I appreciated when you talked about barriers. When healthcare providers understand the barriers, either at the community level, systems level, at the organizational level, it's easier to address those barriers. Yep,
Hmm.
yep, yeah. So yeah, I think you've really spoken a lot. And once again, thank you for joining us. It's a
Well,
privilege
thank
to
you.
have you with us. So, what is the highlight of your career as a health expert with 3 to 4 decades uh, of experience?
Yeah, not quite four, but getting to 3 decades, and oh my goodness, there's been many highlights of my career. I've been very satisfied with my choice to go into this field, and I feel honored and privileged to have had the opportunity to work with many different individuals, support people in community, work with different clients. And I think for me, some of the highlights of my career was working on the Toronto Indigenous Health Advisory Circle, and the strategy that was developed, and really learning a lot from our urban Indigenous folk, the expertise, the knowledge, the wisdom, working with the elders was really quite profound for me. And just having a deeper understanding of the issues that impact our Indigenous folk, and trying to really decolonize and change a system, which is very challenging, um, to really improve the health outcomes. That it was really amazing experience and opportunity, and I felt very honored and privileged to be welcomed and to learn. And I think I did a lot of learning and maturing and increase my understanding. I believe it really helped me become a better leader as well. I do, you know, as difficult as the pandemic was, we had the opportunity, and I think I had the opportunity to work so closely with some of our partners, such as the school boards, etc., to really provide as much support, expertise, um, throughout a very difficult and challenging times when we did see the impact, particularly on some of our communities, on our children, and really developing those relationships so that we could support and work together as best as possible. Um, it was such a challenging time, but you formed such strong relationships with your team members that were within your organization and without, because we had to support all one another in order to get through a very, very difficult time. I hope to not be practicing and see another pandemic, at all. It was very, very, very difficult, and we're still recovering. We're seeing that recovery in a lot of the healthcare sector as people left the profession, retired. So we do have a health human resource crisis, which is challenging because people went through a lot. And we need, resilient, committed, caring people to work in the field. Long-term care experienced significant impacts throughout the pandemic. So, putting a plug in for anybody that wants to come in the profession and care for people and provide that support. Always looking for really good, committed, dedicated people that will help the most vulnerable in our communities.
Okay, thank you, Dr. Nicole. And your highlights when you mentioned working with the indigenous communities, decolonization of the system to address the inequities. I think that is a very profound approach to addressing the deep-rooted inequities that have
Mhm.
existed over decades, over centuries, and
Yeah,
it looks like they are still reoccurring, and we still see them.
yeah.
Yeah, and I think if that sums up the essence of this interview and the essence of our annual health week, wellness for everyone,
Yes.
addressing the inequities across populations, especially those impacted more.
Mhm,
Yep.
mhm.
Yeah.
Yep, and we've made a lot of progress, and there's lots of work needed still, but there's a lot of hope. There's a lot of hope that we see, change coming and people entering the profession that are dedicated and committed. So thank you, and thank you for the opportunity to speak with you today.
Yeah, and in your current role as the City of Toronto manager for senior services, I mean, um, I don't want to ask you what are your final words to the public, but just say anything you would like to tell us before we call it a day today.
I think, in my short time with this division in the City of Toronto Senior Service and Long-Term Care, I've had the opportunity to meet many of our staff and residents, and just seeing the dedication and care that staff are provide to the residents, provide to one another, has been so inspirational, and it's my privilege and honor to be leading this division. I am working with many great leaders and staff. I just think there's so much hope that recovery is there. And although we went through a very difficult time during the pandemic, there's so many committed, caring, dedicated staff that really make the world of difference. You know, we makes you want to get up every day and come in and make a difference so that we're providing the highest quality care to our residents and seniors in community, because we offer community programs as well for seniors living in Toronto. So I just think it's inspirational. It's really, really quite inspirational.
Okay, thank you, Dr. Nicole Welch, for joining us today.
Thank you.
And we look forward to having you in subsequent annual health weeks.